Welcome everyone. My name is Chanel Taylor. Today we'll explore and learn about dystonia, an important neurological disorder. We'll discuss its symptoms, how it affects the body, diagnose, and its impact on individuals and society. Dystonia is a complex movement disorder that affects muscle control. We'll cover its history, types, causes, clinical presentation, and the current treatment strategies. The first formal description of dystonia came in 1911 from German neurologist Hermann Oppenheim. He coined the term dystonia, mum deformis, after discovering children with twisting movements and abnormal postures. The original name for dystonia muscularum deformis. Initially, some doctors thought it was psychological, but the view changed as more neurological evidence emerged in the 20th century. It was understood as a brain-based movement disorder, and in the 1990s, scientists identified key genetic mutations like DYT1 that deepened our understanding. The name was then changed to torsion dystonia due to the changing understanding of the problem. Dystonia 2024. What is dystonia? Dystonia is a chronic neurological movement disorder. It is not just a single disorder, but a syndrome that is presented in a variety of ways, marked by involuntary muscle contractions that cause twisting movements and abnormal postures. These syndromes can be painful, disabling, and are often worsened by voluntary action. Depending on the type of severity, these spasms may affect a single body part or a widespread area. The condition results from dysfunction in the basal ganglia, a group of structures deep in the brain, responsible for coordinating movement. However, dystonia does not typically affect cognition. It can considerably impact a person's physical function and emotional well-being. Classification. Dystonia is classified by the affected body part and cause. Focal dystonia targets one area of the body, like the neck. Segmental dystonia impacts on connected parts of the body, so two parts of your body that are connected within the same area. Multifocal dystonia affects multiple unrelated areas. So this would be areas in your body that technically do not touch one another. So say it's your leg and your arm. And generalized dystonia involves most of the body. Primarily, dystonia has no known cause, while secondary dystonia stems from trauma, stroke, or medication. In this diagram, you'll see the different clinical characteristics of dystonia, from the age of onset to the body distribution, the different patterns, and how the disorder will be presented within the body, and then the associated features of what portion of the body and how much of the body is being disturbed by this disorder. Dystonia manifests in various forms, with one of the most recognizable being the cervical dystonia, which causes painful twisting of the neck. Other types, such as belt spasms and writer's cramp, are often misdiagnosed or overlooked due to their localized effects. In a healthy body, motor control is regulated by a network of brain regions, including the basal ganglia. However, individuals with dystonia experience abnormal signaling in these areas, disrupting the coordination between muscles. This distribution leads to involuntary movements and postures characterized as dystonia. Symptoms of this disorder include muscle spasms, abnormal postures, tremors, and fatigue. These involuntary muscle contractions and repetitive movements can lead to muscle tightness, cramping, and trembling, which often worsens with stress or fatigue. Depending on the affected area, these symptoms can be painful and significantly limit an individual's ability to perform everyday tasks, such as walking, writing, or speaking. Common symptoms include uncontrollable muscle spasms, twisting movements, and awkward positions. Some individuals may also experience pain, fatigue due to the overuse of muscles. Additionally, symptoms begin in one part of the body and potentially spread to other areas over time. The diagnostic process for dystonia involves clinical observation, neurological examination, and supportive imaging or genetic testing to rule out secondary causes. While dystonia is classified as its own disorder, many other conditions with unique characteristics also fall under this category. Understanding this disorder is crucial for early diagnosis and appropriate treatment, which can significantly enhance the quality of life for those affected. Diagnosing typically begins with a comprehensive neurological exam. Imaging tools such as an MRI, a CT scan, are used to rule out any structural abnormalities. Additionally, an electromyography EMG also helps detect unusual muscle activity, and genetic testing can identify specific mutations. Each of these diagnostic tools aids in confirming the diagnosis and excluding other conditions. Risk factors for dystonia can be categorized as modifiable and non-modifiable. Modifiable risk factors include age and genetic disposition. For example, some types of dystonia, like early onset generalized dystonia, are linked to genetic risk. Other modifiable risks may involve avoiding exposure to certain medications or toxins known to impact neurological function. Inherited forms of dystonia, such as those related to the DYT1 gene, differ from acquired forms, which may result from neurological injuries or side effects of the medication. Understanding the root causes of dystonia is essential for effective management. Although dystonia cannot always be prevented, minimizing brain injuries and avoiding long-term use of certain medications can help reduce the risk. Dystonia is slightly more common in women. Genetic forms typically appear in childhood, whereas acquired forms often manifest in midlife. Socioeconomic factors can influence access to care more than actual risk. Treatments for movement disorders is highly individualized and may involve a variety of approaches. Common treatments options include medications such as muscle relaxants and dopamine regulators. Botulinum toxin injections, also known as Botox, are also utilized to reduce localized muscle contractions. Surgical interventions such as deep brain stimulation may be considered in more severe cases. Physical therapy is crucial in managing movement disorders and can incorporate techniques such as transcranial magnetic stimulation, motor learning experience, and passive and active mobilization strategies. Effective management may also involve stretching diastonic muscles, practicing relaxation techniques, and utilizing electrotherapy. While there is currently no cure for dystonia, treatments like Botox injections, oral medications, and in some cases, deep brain stimulations can significantly alleviate symptoms. Additionally, Physical therapy and counseling, also group therapy, are essential for improving the overall quality of life. Living with dystonia often requires resilience. Beyond the physical discomfort, the condition can be socially isolating. However, the right support, both medical and emotional, patients can live meaningful lives. Thank you for your attention. Dystonia is a complex condition, but with early diagnosis and proper care, many individuals can live meaningful lives. While dystonia poses challenges, it is also manageable. Understanding the clinical presentation and available treatment options is essential for ensuring timely interventions and achieving better outcomes for patients. I hope you enjoyed my presentation.